Hello doctors. Today, being the month of October, let's talk about an important and globally concerning topic, that is about the breast cancer. October is the month of breast cancer awareness. So I thought that I should contribute something for the people who have this, and also I wanted to stop the incidence of breast cancer, so that I thought that I could teach about breast self examination. So this is a small contribution from me, and I would like to share this to everyone, and I would also like you to share this, and even if any one single person gets benefited out of this, I would be really happy. Now let's see about it. Let's first see the normal anatomy of the breast. Imagine these are the breasts, and they extend in the top from the clavicle, that is your collarbone, and at below at the sixth rib. In the center is the sternum bone, and in the sides are the mid axillary line, that is below your axilla. So this is where the breast lies, in the top from the clavicle to the sixth rib, and from the sternum to the mid axillary line. Now just take this, and if we divide the breast into four parts, we will get four quadrants, that is the upper outer quadrant, the upper inner quadrant, the lower outer quadrant, and the lower inner quadrant. Now if you see, we have divided the breast into four quadrants, and remember that most of the breast cancer arises in the upper outer quadrant. Now let's see some common concerning complaints which you might have, and you have been ignoring this all the while. That could be breast lump. It could be a small one or a big one. It could be freely moving or it could be fixed. Whatever it is, it must be dealt with. Now you may also have breast pain or nipple discharge. It is important to know the color of the discharge, and breast skin dimpling or also nipple retractions. Now let's talk about breast self examination. This can be done every month, but the best time to do this is 5 to 7 days after the onset of menstruation. That is, if you are menstruating today, and from today, after 5 to 7 days, that will be the best time to do the breast self examination, because this time the estrogen exposure would be low, and you can clearly get the if there is any lump, you can clearly see it. If not, if you do before the menstruation, the normal size of the breast would be interfering with the lump, and you could not be able to see it clearly. So it is advised to do after 5 to 7 days after the onset of menses. Now what would be some common complaints you might have? Just like I said before, breast lump, breast pain, discharge, dimplings and retraction. Even if you have this or if you don't have, you should do breast examination every month, so that you could find if any of this is present or not, and if it is present, you can deal with it very soon. Now let's see how to do it. There are just simple 5 steps in breast self examination. You could do this at home by yourself. Now step 1 is, you should lie down flat and keep a pillow behind your right shoulder. You just lift your right arm and keep it behind your head, and Below the right arm, you should keep a pillow. Now, with the left hand, you should examine your right breast. This is how you do it. This is step 1. Now, step 2. What you have to do is use these finger pads, the edge of the fingers. Now, use the finger pads of your left hand and press firmly on the right breast and examine for any concerning symptoms. Now, this is how you do it. You should start from the top, then press firmly, and until the bottom. Then you may go from down to up, then from up to down. You should cover every single bit of the breast tissue and check for any lumps. So these were the first 2 steps. First, you lifted your right hand, kept it behind your head and kept a pillow behind the right shoulder. Then step 2, you used your left hand to examine your right breast. Remember this pattern. Then step 3, you just do the same thing for your left breast. Keep your left hand behind your head and insert a pillow behind your left shoulder, and with the right hand fingertips you can examine the left breast in the same up and down fashion. Remember to cover every bit of the breast tissue. Then in step 4, now you got to stand up, and just like before, you just keep one arm behind your head and with the other arm you have to examine the breast. You were doing this while lying, now you are doing this while standing. Now this has a clinically important factor. When you are standing up, most of the breast tissue would go down. So your upper outer quadrant will be easy. When you palpate, you can find any lumps in the upper outer quadrant easily, because most of the breast cancer arises there. Now the last and final step, you just stand in front of your mirror and keep your hands in the hip tightly and look at your breast for any changes. Now you can see here if both the breasts are symmetrical and if there are any dimplings, or if the nipple is retracted, or is there any lump. This is how you inspect your breast. Now just see the 5 steps. Step 1, you kept your right hand up and you examined your right breast with your left hand. Then next you examined your left breast with your right hand. Then you stood up and did the same thing, and then stand in front of the mirror and just check your breast for any abnormalities. Now let's talk a bit about the breast cancer. This is the most common cancer in women worldwide. Then the most common location, as I said, is the outer quadrant. So you have to check this area very properly. Now there is a breast cancer risk assessment tool. Here is the website for it. If you want to check that if you have breast cancer, or what are the possibilities, or how much percentage you could have breast cancer, if you want to check that, you can just go to this website. This website will show you how much percentage that you possibly can have breast cancer. This will just ask about your history, your family history, and just a little more details, and it will tell the chances of you having breast cancer. So you can check this. Then it is advised to start screening after 50 or even before that if you have any risk factors. Mostly after age 50, it is advised to go for a mammography 2 times a year. But if you think you have any risk factors like family history, or if you see any lump before, you can do the screening even before 50. Now let's see what are the risk factors for one to develop the breast cancer. The most important risk factor is age. If you're above 50, then your chances of having breast cancer increases. Just like that, if you are below 40, the chances of you having breast cancer is less. Then family history. We all know that the breast cancer, it is most of the time people would say like they had some family history. Then early menarche or late menopause, in which the patient is exposed to the estrogen for a long time. Early menarche to late menopause, in between this the patient is fertile, so there is more estrogen exposure, and so there can be more chances of having breast cancer. And then obesity after menopause, alcohol use, physical inactivity which can lead to obesity, and some contraceptives like oral contraceptive pills which is said to have breast cancer, yet it is not confirmed. Now let's see a small thing about the lymph drainage of the breast. If you see here, this is the upper outer quadrant I said, where most of the breast cancer would arise. There is a central node at the axilla. This is the axilla, and the pectoral nodes drains the front anterior chest and the breast, and it gives its drainage to the central node. Then the subscapular node will collect the fluids from posterior chest and give it to the central node, and the lateral node collect from the fluid from the arms and give it to the central node. This central node passes the fluids to the supraclavicular and infraclavicular nodes. Now if anyone has breast cancer, that can spread directly to the supraclavicular or the infraclavicular nodes, or it can go to the central node and then spread everywhere. Now the point I am mentioning this because you can see some people having like this. Now in this, the patient, the breast cancer has spread to the central nodes, so you can see a small lymph node bulge in this axilla. That is the central node that has bulged. When you see like this, immediately you have to think about the risk factors, and you have to check for the breast for any masses or lumps. So if you see this one, do not leave this just like that, especially in the women. Now that's my contribution for the month of October, the breast cancer awareness month. Now share this video to many people so that they would be aware of breast self-examination, and they can detect any abnormalities if present and get the treatment as soon as they can. And that's all for today. Thank you.